Hello, and welcome to Chapter 4. In this chapter, we're going to take a look at consciousness, the shifting states of awareness that shape how we think, feel, and function. We'll cover why we sleep, what happens in the brain during the different stages of sleep, why we dream, and what happens when sleep is disrupted. We'll also talk about how drugs, hypnosis, and meditation can alter our consciousness. But before we dive in, let me ask you this. How many hours of sleep did you get last night? And if you were honest, do you feel like that was enough? So let's start with the big question, what is consciousness? When we use the word consciousness in psychology, we're talking about awareness. That includes awareness of what's happening inside of us, like feeling hungry, tired, or stressed, and the awareness of the outside world, like noticing that the lights are too bright or hearing your phone buzz. But consciousness isn't just a simple on off switch, it exists in levels. You can be fully alert and focused in class, you could be zoning out and daydreaming, or you can be deeply asleep and only faintly aware of your surroundings. This is where the idea of wakefulness comes in. Wakefulness describes a high level of sensory awareness, active thought, and behavior. When you're awake, your brain is constantly processing information and responding to the environment around you. To capture this idea, the textbook shows us a painting from 1895 called Two Sleeping Girls on the Stove by Swiss artist Albert Anker. The painting depicts two children asleep on a bench near a stove, completely withdrawn from the outside world. It's a simple but powerful reminder of how different states of consciousness look and feel, from active alert wakefulness to the quiet restorative state of sleep. Now, these shifts in consciousness don't just happen randomly. They're tied to biological rhythms, the natural cycles of activity within our bodies. Biological rhythms can be short or long. They include things like the rise and fall of body temperature across the day, the monthly menstrual cycle, or changes in alertness throughout the day. One of the most important rhythms for psychology is the circadian rhythm. You've probably heard this term before. The term circadian literally means about a day, and that's exactly what it is. It's a roughly 24-hour cycle that governs patterns like sleeping and waking, fluctuations in alertness, and our body temperatures. Circadian rhythms are heavily influenced by light in the environment. So, body temperature naturally rises during the day, peaks in the afternoon, and then drops at night, signaling that it's time to rest. So, when you feel alert in the morning, sluggish in the afternoon, or wide awake at midnight, that's not just you. That's your circadian rhythm shaping your level of consciousness. This is also why pulling an all nighter or trying to sleep at odd hours feels so hard. Your body temperature rhythm is really working against you. One way we know how strong our circadian rhythm is comes from research on people who have been kept in environments without natural light. Even in total darkness, with no clocks, windows, or outside cues, people's bodies will still stick to a roughly 24-hour cycle of sleeping and waking. The rhythms may drift a little longer or a little shorter than 24 hours, but the pattern holds. This shows that our circadian rhythm isn't just a reaction to the environment, it's internally driven by the brain's clock. Light helps to fine tune it to the outside world, but the rhythm itself is built in. So think about the last time you completely zoned out. Maybe you were driving, scrolling on your phone, or sitting in class. Were you conscious in the sense of being awake? Yes. But were you fully aware of what was happening around you? Probably not. That's the spectrum we're going to be exploring in this chapter. Deep inside the brain, in the hypothalamus, is a tiny structure called the suprachiasmatic nucleus, or SCN for short. It's often called the master clock of the body. Even though it's only about the size of a grain of rice, it plays a huge role in keeping the body's rhythms on track. The SCN gets its information about light from the eyes. Specialized cells in the retina send signals to the SCN about whether it's light or dark outside. Based on that input, the SCN tells the rest of the body how to adjust. So, for example, when the SCN detects that it's nighttime, it sends signals for the release of hormones to make you feel sleepy. When the SCN senses morning light, it helps suppress those same signals, allowing you to feel alert again. One of the main hormones involved is melatonin. The pineal gland, located just behind the brainstem, releases melatonin when the SCN signals that it's dark. This rise in melatonin levels promotes sleepiness, basically telling your body, hey, it's time to wind down and go to sleep. When the sun comes up and light hits the retina, the SCN suppresses melatonin production, helping you feel awake. This system is what psychologists call sleep regulation, the brain's ability to switch us between sleep and wakefulness and to line up those states with the outside world. But it's not just an on-off button. Instead, it's a coordinated process involving multiple brain areas and hormones that together make sure our sleep and wake cycles happen in the right rhythm. And importantly, sleep regulation isn't the same for everyone. Some people are naturally more alert in the morning, while others are naturally more alert at night. This personal pattern is called your chronotype. If you've ever heard someone described as a night owl or an early bird, that's really a reflection of their chronotype, their individual version of this sleep-wake rhythm. So now that we know how sleep is regulated, let's talk about what happens when that system gets disrupted. One common disruption is jet lag. If you've ever flown across several time zones, you know the feeling all too well. Your body still thinks it's nighttime when it's actually morning where you've landed. This mismatch between your internal circadian clock and the new environment can cause fatigue, irritability, and trouble concentrating. Another disruption that's really common is rotating shift work, which happens when people switch back and forth between day shifts and night shifts. Their bodies never fully adjust to a stable rhythm, so they end up constantly out of sync with their environment. This can lead to exhaustion, difficulty sleeping, even when they have the chance, and over time, it's been linked to higher risks of anxiety, depression, and physical health problems. One treatment that helps with both jet lag and shift work is exposure to bright light, which can help reset the SCN and bring the circadian rhythm back into alignment. But beyond disruptions, many people also deal with sleep deprivation, which is just simply not getting enough sleep. This isn't just about feeling tired. Missing sleep affects almost every part of the body. Cognitively, our attention and memory suffer, making it harder to learn and perform well. Physically, the immune system weakens, metabolism is disrupted, and reaction times are slowed down. Emotionally, people are more irritable and less able to manage stress. In fact, prolonged sleep deprivation can be as impairing as an alcohol intoxication in terms of reaction speed and judgment. Psychologists also use the term sleep debt to describe the cumulative effect of not getting enough sleep. Think of it like borrowing from a sleep bank. If you lose a couple of hours one night, you owe that time back to your body. Over time, this debt piles up, leading to greater fatigue and worse performance. When you finally do get the chance to rest, your body often tries to pay back the debt through sleep rebound, where you fall asleep faster and stay in deeper stages of sleep for longer than usual. And it's also important to remember that sleep needs change across your lifespan. Infants sleep for 14 to 16 hours a day because so much of their growth and brain development depends on it. School-age children and teenagers need more sleep than adults, but many don't get enough because of early school start times and busy schedules. Adults usually need around 7 to 9 hours of sleep per night, though many push through with less. In older adulthood, total sleep time often decreases and sleep can become more fragmented, with more nighttime awakenings. All of this to say that sleep isn't just downtime. It's a biological process that's vital, and when we disrupt it or fall behind, our bodies and minds quickly feel the effects. So, we've talked about rhythms and regulation, but what exactly is sleep itself? Psychologists define sleep as a state marked by relatively low brain physical activity and reduced awareness of the external world. During sleep, the brain is still active, but in different ways than during wakefulness. It isn't a complete shutdown, it's more of a highly organized biological state with its own stages and functions. Sleep is really linked to several important hormones, so we've already talked about melatonin, which triggers sleepiness at night, but other hormones are also important and rise and fall as we sleep. We have growth hormone, which is released by the pituitary gland, that plays a role in physical development, tissue repair, and metabolism, and this is especially critical for children and adolescents. We have follicle stimulating hormone, or FSH, and luteinizing hormone, which is LH, and those are also secreted by the pituitary gland They're important for reproductive processes and are also released during our sleep. Here in this illustration, you can see several brain regions that are pointed out here, and each one plays a different role in managing our sleep-wake cycles. So we have thalamus here, and this structure is the brain's relay station. It passes sensory information along to the other areas of the brain. During most stages of sleep, the thalamus becomes less active, which helps block out sensory input and allows us to stay asleep even when things are happening around us. However, during REM sleep, the thalamus reactivates and sends sensory information to the cortex, which is one reason dreams can feel really vivid and lifelike. Then we have hypothalamus here, sitting just above the brainstem, and the hypothalamus is key to homeostasis and helps keep the body balanced. It houses that SCN, which we discussed earlier is the body's master clock, and the hypothalamus helps control the timing of sleep and wakefulness, coordinating with light signals from the eyes and hormonal changes in the body. We have pons here, and this is a part of the brainstem that is really crucial for REM sleep. This helps initiate REM and also causes the paralysis of voluntary muscles that happens in that stage. That's why even though you might be running in your dreams, your body isn't actually moving. We have the pineal gland here, which is a small gland, but it plays a big role in releasing melatonin in response to darkness, signaling to the rest of the body that it's time to go to sleep. And we have our pituitary gland, which is that master gland. It releases hormones during sleep like growth hormone, FSH, and LH, which are important for physical growth and reproductive health. So this is a reminder that sleep isn't controlled by just one singular part of the brain. It's a networked process, different areas working together to time, regulate, and maintain sleep, while also shaping what we experience in our dreams. So this brings us to the question, why do we even sleep at all? There are a couple of main theories. One is the adaptive function hypothesis, which suggests sleep evolved as a survival strategy. So for early humans, being active at night in the dark increased the risk of becoming prey. By sleeping at night, humans and other animals may have reduced dangers and conserved resources. While this idea makes sense, there's not a lot of strong evidence that predation risk alone explains sleep. Another explanation focuses on the cognitive function of sleep. Research shows sleep is critical for memory, learning, and thinking, and sleep deprivation disrupts attention, problem solving, and memory formation. In particular, slow wave sleep seems essential for consolidating our memories, so taking what we've learned during the day and saving it into long-term storage. And finally, there's the broader benefits of sleep. So sleep helps to maintain a healthy weight, regulate stress, and boost our mood. It improves motor coordination and reaction time. It even strengthens the immune system. Most importantly, it supports cognition and memory, making it easier to learn, retain, and use information. So while sleep may look like inactivity, it's actually an active biological process with deep benefits for both the body and the mind. When we record brain activity during sleep with EEGs, the patterns shift noticeably across the night. You'll hear 3 wave categories a lot: alpha waves, which are more relaxed wakefulness, theta waves, which are lighter sleep, and delta waves, which are the slow, high amplitude waves of deep sleep. These aren't just random squiggles. Each pattern maps onto particular sleep stages and levels of awareness. So stage 1 is brief transition from wakefulness into sleep. Breathing and heart rate slow, muscles loosen, and awareness of the room fades. EEG activity drifts from relaxed alpha towards slower theta activity. Many students describe this as the drifting moment. Sounds blur, thoughts feel floaty, and it's easy to pop back awake if someone says your name. Stage 2 is truly light sleep, but it's deeper than in stage 1. The hallmark feature here are sleep spindles, quick bursts of high-frequency activity thought to support memory and learning, and also K-complexes, those single very high-amplitude spikes that can help protect sleep by briefly checking the environment without fully waking you up. So if a door clicks down the hall, the EEG may show a K-complex as your brain registers the noise and then lets you continue sleeping. A couple of examples of sleep spindles So the first one is after a late night study session, the brain replays bits of new material, and spindles are one sign it's doing memory work. The other one could be practicing a new motor skill like practicing piano or pickleball serves, and that often shows more spindle activity that night and better performance the next day. A couple of examples of K complexes. The first one is your roommate may open the fridge, your brain registers the sound, so a K complex, decides it's not important, and lets you stay asleep. The other example here is a phone vibrates once on a desk and you don't wake up, but the EEG shows the brief protective surge. Stages 3 and 4 are slow wave sleep, the deep restorative part of the night dominated by delta waves. Heart rate and breathing are at their lowest. This is when it's hardest to wake someone and when waking can feel groggy and disoriented. Slow wave sleep is strongly tied to bodily restoration and to certain kinds of memory consolidation, especially that save it for later storage of newly learned material. REM sleep. REM stands for rapid eye movement. On the EEG, REM looks surprisingly similar to wakefulness, fast desynchronized activity, yet the body is functionally offline. Voluntary muscles are paralyzed, which keeps dreams from turning into real-world actions. REM is the stage most associated with vivid story-like dreams. So, as an example, in REM, you might dream that you're sprinting across the airport to make it to a flight, but in the real world, your legs won't move because of the brainstem, pons, suppresses motor output. A hypnogram is a chart of sleep stages across the night. People cycle through NREM to REM through about every 90 minutes, with REM periods tending to lengthen in the second half of the night. Deep, slow wave sleep is more front-loaded, appearing more in the first few cycles. So for those of you who have watches or apps on your phone that track your sleep, these are really interesting. Most of these phone or wearable apps estimate stages using movement and sometimes your heart rate. They're decent at flagging broad patterns like restless versus settled nights and approximately your wake and sleep times, but they're not the same as the clinical hypnogram, which uses the EEGs and other testing parameters. You can frame these apps as helpful for habit tracking and bedtime consistency, but not an overall diagnosis of how you may or may not be sleeping. Dreams are something that are really, really interesting, and there's many theories on the meanings of dreams that vary across different cultures and periods of time. So according to Freud, dreams are a route to the unconscious. He distinguished manifest content, which is what you remember seeing, from latent content, which is the underlying meaning. So for example, you might dream that you showed up to an exam that you forgot to study for, which is the manifest, and the latent content might reflect anxiety about evaluation or fear of being judged as unprepared. According to Jung, dreams can tap into a collective unconscious, so shared universal archetypes like the shadow, the hero, the wise elder. Symbols in dreams may resonate across cultures. For example, dreaming of wandering through a dark forest can echo the archetype of the unknown challenge, or meeting a mentor-like figure on a trail reflects the wise guide archetype. Dreams may also represent life events that are important to the dreamer. So things like dreaming like I can't find my classroom the night before the first day of school, or my phone won't unlock, or I can't dial emergency services during stressful weeks, or after hours of driving, dreaming of endless highways. Dreaming may also represent a state of proto-consciousness, so dreaming acting like a virtual reality simulation that supports waking life functions like emotional regulation, threat rehearsal, and social navigation and memory organization. So for example, rehearsal dreams where you finally say the thing that you couldn't say during a conflict, or threat simulation dreams that practice quick appraisal and escape responses in a safe environment, or creative problem-solving dreams, like waking up with a fresh approach to a stubborn essay or a problem you've been having at work. Now, lucid dreams are something that's kind of interesting. A lucid dream is where the dreamer becomes aware that they're dreaming, sometimes gaining limited control over what happens next, like changing the setting, choosing to fly, or confronting a fear. Lucidity blends features of wakefulness, like metacognition and self reflection, within the dream state. So, for example, realizing mid dream, wait, gravity is wrong. This has to be a dream. And then choosing to lift off the ground and fly. Or turning a recurring chase dream into a confrontation where you stop running, face the pursuer, and ask a question. Often the scene changes or the fear drops. Or practicing a performance like a piano or nursing lab checks with a sense that this is a dream, but I can rehearse it anyway. These stages shape how we sleep, what we remember, and what we dream. But for many people, sleep doesn't always follow the ideal pattern. Psychologists group these difficulties under the broad category of sleep disorders, disruptions in the quality, timing, or process of sleep that interfere with daily life. So we have insomnia. The most common sleep disorder is insomnia, which means having persistent difficulty falling asleep, staying asleep, or getting restful sleep. To count as insomnia in the clinical sense, these problems occur at least 3 times a week for a month or more. Insomnia is linked with depression, anxiety, and stress. Common contributing factors include drug use, poor sleep hygiene like irregular bedtimes, heavy screen use, or loss of caffeine late in the day, and mental health struggles. Treatments often combine stress management, establishing healthier bedtime routines, and cognitive behavioral therapy, which helps people challenge unhelpful thoughts about sleep and build better habits. There was a branch underneath of cognitive behavioral therapy, which is cognitive behavioral therapy for insomnia, which is a specialized protocol in actually working with people directly with insomnia. Parasomnias are unusual motor behaviors or experiences that happen during sleep. They're disruptive but not always remembered afterwards. So, REM sleep behavior disorder, normally the body is paralyzed during REM sleep to prevent acting out our dreams. In RBD, that paralysis doesn't happen, so people may kick, punch, shout, or move around while dreaming. This can be dangerous both to the sleeper and a bed partner. RBD is often treated with medications such as clonazepam. Sleepwalking typically occurs during deep, slow wave sleep. The sleeper may sit up, walk around, or even perform simple tasks. While it can be startling, sleepwalkers usually have no memory of the event. Restless leg syndrome is a condition where people feel uncomfortable sensations in their legs, especially when trying to fall asleep. Moving the legs relieves the feeling temporarily, but it makes it hard to settle into sleep. Medication person may suddenly scream, thrash, or try to escape, appearing terrified but often not being fully awake. There is a difference between nightmares and night terrors. Nightmares are vivid REM dreams that you can usually recall on waking. Night terrors arise out of NREM and they involve intense panic and are often not remembered. Keeping this distinction helps you to map experiences to stages accurately. Sleep apnea occurs when breathing repeatedly stops and starts during sleep. These pauses can last 10 to 20 seconds or longer, disrupting sleep and lowering oxygen levels in the body. There are 2 main types of sleep apnea. There is obstructive sleep apnea, which is caused by a physical blockage of the airway, for example, tissue collapsing at the back of the throat. And then there's central sleep apnea, which is caused by the brain failing to send the right signals to the muscles that control breathing. People with sleep apnea often snore loudly, wake up gasping, and feel excessively tired during the day. Treatments can include lifestyle changes, medical devices like a CPAP machine, which helps to keep the airway open with continuous air pressure, and sometimes surgery. SIDS refers to the sudden and unexplained death of an infant under 12 months of age, usually during sleep. It is rare but devastating. Boys are at slightly higher risk than girls, and risk factors include premature birth, overheating, and smoking in the home. The Safe to Sleep campaign educates the public about how to minimize risk factors associated with SIDS. The importance here is on prevention and information, never judgment. Narcolepsy is a disorder marked by sudden, irresistible episodes of sleep during waking hours. These sleep attacks can be triggered by heightened arousal or stress. Narcolepsy often includes features of REM sleep intruding into wakefulness. Cataplexy, or sudden loss of muscle tone, ranging from slight weakness to temporary paralysis, or which are vivid dreamlike experiences that occur as a person is falling asleep. Narcolepsy is usually managed with medications such as stimulants to promote wakefulness. When researchers and psychologists talk about substance use disorders, they're describing a compulsive pattern of drug use despite serious negative consequences. According to the DSM-5, this includes both physical and psychological aspects. Physiological dependence is when the body adapts to the drug, altering normal functioning. If the drug use stops, the person may experience withdrawal symptoms, and often they do. Psychological dependence is an emotional or mental craving for the drug, where the person feels they need it to function, cope, or to feel normal. Over time, people may develop tolerance, meaning they need higher and higher doses to get the same effect they once got from smaller amounts. And when the drug is suddenly discontinued, they experience withdrawal, symptoms that can range from irritability and headaches to severe life-threatening reactions depending on the drug. Drugs are grouped into major categories and each affecting the central nervous system in different ways. So, depressants reduce neural activity and slow down bodily functions. They mainly act as GABA agonists. Remember, GABA is the brain's primary inhibitory neurotransmitter. It quiets activity. When depressants increase GABA's effects, neurons are less likely to fire, which leads to relaxation, sedation, and slowed reactions. Alcohol is the most widely used depressant. At low doses, alcohol can reduce inhibitions and create a sense of relaxation. At higher doses, it impairs coordination, judgment, and reaction time. Very high doses can result in unconsciousness and even death. Alcohol is highly addictive for some individuals because of its effect on dopamine reward pathways as well as GABA. Barbiturates, like some anticonvulsants, and benzodiazepines like Valium or Xanax, also fall into this category. They can be effective for short-term medical use, but carry strong risks for dependence and overdose when misused. So think about reaction time. If alcohol slows neural firing, driving after drinking is dangerous because the brain simply cannot process information quickly enough to react to the dangers of the road. GABA is the brain's main inhibitory neurotransmitter, and its job is to slow things down. When GABA binds to its receptor on a neuron, it makes the neuron less likely to fire. Think of it as the brain's brake system. Depressants like alcohol, barbiturates, and benzodiazepines work by enhancing GABA's effects. So on the GABA-gated chloride channel, there are multiple receptor sites. Depressants bind to these sites, which opens the channel and lets negatively charged chloride ions flow into the neuron. This influx pushes the cell's electrical charge further negative, making it harder for the neuron to reach the threshold to fire. The result is a quieting effect across the brain, slower reaction times, reduced coordination, lower alertness, and in high doses, sedation or unconsciousness. So for example, after a few alcoholic drinks, speech starts to slur and coordination drops because GABA activity has slowed the firing of neurons in motor and speech areas. Anti-anxiety medications like Xanax, which is a benzodiazepine, calms the nervous system by boosting GABA activity and essentially turning down the volume on overactive circuits. But because GABA's role is so central to basic brain activity, altering it repeatedly with depressants can make the brain adapt, leading to tolerance, dependence, and dangerous withdrawal. That's why alcohol withdrawal, for example, can include tremors, seizures, and severe anxiety. The brain has lost its normal balance between excitation and inhibition. Stimulants have the opposite effect. They increase alertness, arousal, and activity in the nervous system. Most stimulants work as dopamine agonists by blocking dopamine reuptake, which floods the synapse and increases reward signaling. So cocaine increases intense euphoria, confidence, and energy. But it also raises blood pressure, increases heart rate, and is extremely addictive. Amphetamines like Adderall or methamphetamine increases dopamine and norepinephrine. They can boost focus and energy, but also cause anxiety, paranoia, and in high doses, hallucinations. Cathinones, often referred to as bath salts, are synthetics that mimic amphetamine effects, known for dangerous side effects including aggression, paranoia, and cardiovascular strain. MDMA, like ecstasy or Molly, increases dopamine and serotonin. Users may feel emotional warmth and sensory enhancement, but it can also cause dehydration, overheating, and long-term serotonin system damage. Side effects across stimulants include nausea, anxiety, paranoia, insomnia, and potential for cardiovascular problems. Their addictive potential is very high because dopamine reward circuits are strongly engaged. Dopamine is a neurotransmitter heavily involved in the brain's reward system. It helps regulate motivation, reinforcement, and feelings of pleasure. When dopamine activity spikes, the brain essentially says, "That felt really good, let's do it again." Stimulants like cocaine and amphetamines are dopamine agonists, meaning they boost dopamine's effects, but instead of directly mimicking dopamine, they act by blocking reuptake. Normally, after dopamine is released into the synapse, the space between the neurons, it quickly is reabsorbed by the presynaptic neuron. Cocaine and amphetamines block this reuptake, leaving more dopamine floating in the synapse. This overstimulates the postsynaptic neuron, creating an intense and prolonged feeling of euphoria, confidence, and energy. So why is it so addictive? Because dopamine is tied directly to the learning and reinforcement. Drugs that flood the brain with dopamine teach the brain very quickly to seek them out again. The more dopamine agonists are used, the more the brain adapts, reducing natural dopamine function and making everyday rewards like food, relationships, and hobbies feel less satisfying in comparison. This is one of the main drivers of stimulant addiction. So let's talk about nicotine and caffeine. Both are legal stimulants. Nicotine is found in tobacco and in vapes, and it interacts with the acetylcholine receptors, boosting arousal and reward. Nicotine is one of the most addictive substances we know, and many smokers report difficulty quitting even when they're highly motivated. Caffeine is also the world's most widely used psychoactive drug. It works by antagonizing adenosine, a neurotransmitter that promotes sleepiness. This leads to increased alertness and energy. While not considered addictive in the same way as nicotine, people can absolutely develop dependence. Headaches, irritability, and fatigue are common withdrawal symptoms. So maybe you can relate to this, to that "I can't function until I've had my morning cup of coffee" feeling, is essentially mild caffeine dependence. Opioids are powerful analgesics or painkillers. They mimic the brain's natural endorphins by binding to opioid receptors, producing euphoria and pain relief. So this includes things like heroin, morphine, codeine, methadone, and prescription painkillers like oxycodone. Extremely addictive behaviors because of their intense effects on the reward systems. And the risks are things like respiratory depression, so slowed breathing, tolerance, and severe withdrawal symptoms like pain, agitation, and flu-like illness. Hallucinogens alter our perception, thoughts, and emotions. They don't all act on the same neurotransmitters, so their effects vary from substance to substance. LSD acts as a serotonin agonist, producing vivid hallucinations and altered sense of time. PCP and ketamine block the NMDA glutamine receptors, leading to dissociation and sometimes dangerous behaviors. Cannabis has hallucinogenic stimulant and depressive properties depending on the dose and the strain. It works mainly through the endocannabinoid system. Side effects can include hallucinations, altered judgment, panic, or even paranoia. Some hallucinogens like LSD are not physically addictive, but psychological dependence is possible. I wanted to take a moment to address ketamine-assisted psychotherapy. So recently, ketamine has gained attention in mental health treatment. In controlled therapeutic settings, low doses of ketamine are used alongside psychotherapy to help with severe depression, PTSD, and treatment-resistant anxiety. The idea is that ketamine may temporarily increase brain plasticity, allowing therapy to be more effective. But it's important to know that this is not recreational use. Clinical ketamine-assisted therapy is closely supervised by medical professionals, and the context is what makes the difference here. It reduces the harm potential. In therapy, ketamine isn't about escaping. It's about creating a temporary shift that allows stuck thoughts, traumatic memories, or rigid negative beliefs to loosen. And by lowering defenses and increasing brain plasticity, clients can engage more fully in therapy. Because it's controlled and time limited, the risks of misuse, overdose, or injury are dramatically lowered compared to recreational use. So think of ketamine-assisted therapy kind of like a scalpel. In the hands of a trained surgeon, a scalpel can save lots of lives, but in the wrong setting, it can cause serious harm. The tool itself isn't good or bad, it's how and why it's used that makes the difference. So we've covered sleep, dreams, and drugs, all ways our consciousness can shift, but there's also intentional ways that people can alter their state of awareness, like hypnosis and meditation. Hypnosis is a state of extreme self-focus and suggestibility. In this state, people may become more open to following directions or exploring thoughts and feelings in new ways. How it works is usually a hypnotist or a hypnotherapist uses relaxation techniques, focusing attention and guiding the person into a trance-like state. Contrary to Hollywood depiction, hypnosis does not mean someone is unconscious or under mind control. People remain aware of their surroundings and ultimately in control of their behavior. And hypnosis has been used clinically to help people manage pain, cope with anxiety or depression, quit smoking, or lose weight. In some cases, it's also been used in attempts to recover memories, but this is controversial because it can sometimes create false memories. Examples students may connect with. So, for example, hypnosis could be a part of pain management for dental procedures, or there may be programs where hypnosis is combined with counseling to help people break smoking habits. Now, know that hypnosis is not magic. It's a state of focused awareness that can be useful in therapy for some people, but not everyone is equally responsive. And there's also meditation. Meditation is the practice of focusing attention on a single target, like the breath, a repeated word, or even just awareness of the present moment in order to increase mindfulness and calmness. So meditation often involves relaxed but alert awareness. Our thoughts may quiet down, breathing slows, and attention shifts inward. Research shows that meditation can reduce stress, improve sleep quality, and support mood regulation. It can also help with anxiety and depression. Regular meditation has been linked to lower blood pressure, improved immune function, and changes in brain areas tied to attention and emotional regulation. So, for example, mindfulness exercises in class or counseling, like doing a short body scan, is an example of mindfulness. Apps like Headspace or Calm help to guide daily short meditations. And athletes or performers use meditation to center themselves before big games or recitals sometimes. Meditation is not about emptying the mind. It's about practicing awareness, noticing judgments, or noticing our thoughts without judgment, and returning attention back to the present moment. So that brings us to the end of chapter 4. We've looked at consciousness in many forms. What I want you to take away is that consciousness isn't a fixed state. It shifts, it adapts, and it can be influenced by biology, environment, and even intentional practice. As we move into the next chapter, I want you to ask yourself, how does the way our brain works shape the way that we think, feel, and behave?